Hi, this is Mike Smone. I'm Executive Director of the Alumni Relations Office at NJIT. I'm very happy to welcome you to our next Highlander chat. My guest today is Dr. Mark Bagarazzi, class of 1982. He's currently a consultant for many biopharma companies. He was the Chief Medical Officer and Senior Vice President for Clinical Development and Regulatory Affairs at Inovio Pharmaceuticals. He was the Director of Regulatory Affairs for Vaccines and Biologics at Merck. He was an assistant professor of pediatrics at St. Christopher's Hospital in Philadelphia, and was a fellow of the Pediatric Infectious Disease Unit at Children's Hospital of Philadelphia, among many other roles. Dr. Bagarazzi, thanks very much for joining me.
Thanks, Michael. Glad to be here.
Now, you were a fellow of the Pediatric Infectious Diseases Unit, a variety of other roles. You've got a pretty unique perspective on COVID and what's going on with COVID right now. Have you seen anything like what we're going through right now? Is there any historical experience you can compare it to?
Really, the only thing that came to mind was that was even close was when I was attending New Jersey Medical School, which is right down the street from NJIT. It was 1986 to 1990. And AIDS was a new disease that actually didn't even have a virus attached to it yet when I first enrolled. It happened while I was in school. And, obviously AIDS was causing a lot of trouble, a lot of disease, and at that community in Newark, very much so. But also a lot of concern publicly, especially in the early days when information wasn't very good about, different things about the virus. The routes of transmission weren't very clear. Of course, in that case, it wasn't the acute infection that was so dangerous, but really chronic disease that had a very high mortality rate in the early days before there were good medications. Although, it would take up to 10 years for, people to succumb to that disease. But this COVID-19 pandemic is really different in a lot of ways, especially the fact that it's really virtually affecting every American every day, as we know. And of course, the New York, New Jersey area, where most of our alumni probably still call home, is currently the epicenter, sadly. The impact of HIV and AIDS was surely severe, especially in certain high-risk groups, but it never really affected all of us the way this pandemic is, both medically and economically as well.
Yeah, thanks for that. That was one of the things I was very interested to discover was how involved you were. Clearly, at that time, there was so much going on, and particularly with regards to learning about something new like that, but also how the concept of development goes along with treatment, with vaccines, and so on. What I have been interested to discover lately, particularly, was how long that regulatory process is, both for testing but also for discovery. Given the nature of COVID and given your previous experience with regulatory affairs, do you think there's going to be a change in our regulatory and vaccination system? Or do you see this as just something that's part of the process and it's the way we have to go?
Well, I definitely think it's going to affect the system, although I think it'll probably be, sort of very specific effects and not potentially general effects, although general effects would be welcome as well. My hope is that there'll be new or at least much improved mechanisms put in place to accelerate the type of development needed in a time like this, not just for vaccines, but also other preventive and therapeutic options for any future rapidly emerging infection like COVID-19, because many people feel that this won't be the last, and I think that's clearly correct. So I think my hope in general is that the United States will create a new capability to prepare us for the next threat or the next waves of COVID-19 even, which the experts are all predicting is going to happen. It's just in terms of when and how severe it will be. And I think that capability will be much like the creation of TSA in response to 9/11. Some sort of agency needs to be put in place that would encompass all aspects of pandemic preparedness, from rapid test development and case ascertainment and tracking to creating massive stockpiles of personal protective equipment, the PPE that's now in the news. Supplies from gloves to the N95 respirator masks to ventilators, but also probably most importantly, the creation of some sort of logistical organization. The military is very good at logistics, and that capability has been done. So, Bill Gates said more than 5 years ago that World War III was going to be fought against the virus, and sadly, it turns out he was right. So we do have to go to war against these things, and the type of logistic organizations that are used for war are going to have to be used for these sort of threats. If such a system had already been in place on January 12th, when China first announced to the world that there was a threat, then the US might have had no cases, or maybe just a handful, and not the most in the world. And this really isn't a fantasy. Taiwan, Hong Kong, Singapore, and to some extent South Korea were all well prepared. Not because they're so smart, but because they lived through the SARS pandemic several years ago, and they were highly motivated to be ready for the next threat, and they were. And they have contained it quite well. Their plan, they contained, they didn't have to mitigate.
So you did mention therapeutic options. And the way that I understand it from some of our discussions is that there's preventive and therapeutic options. What do you think the prospects are for that in terms of the medical solutions that we currently have available or might be in development?
Well, I think therapeutic options are, all, heavily in progress now, and there's quite a few different avenues different companies are going down, and even where, even looking at older existing drugs that, companies may not be so interested in developing because, the patents have expired on those drugs. So, FDA is stepping in and testing, chloroquine and hydroxychloroquine because they potentially could have some effect on this on this disease, as well as azithromycin, a commonly used antibiotic. So, not just novel drugs like novel vaccines, and different companies like Gilead and Regeneron around the country have different antiviral approaches and potentially even biologic approaches, creating antibodies creating man-made antibodies against the disease, as well as the possibility of using plasma from people who recover. There's a possibility that could be enriched and given to people who are acutely ill with this disease. So there's a wide variety of things going on. Antivirals has not been the most successful area of pharmaceutical development, not like antibiotics for bacteria and fungus. Antivirals have been a little less successful. In some cases, they've been very successful, like against herpes viruses. Those have worked out really well. But against influenza, for instance, there are antivirals available, but their efficacy, their effectiveness is modest currently. But massive amounts of research and effort is going into this, and multiple trials are ongoing as we speak to see what might work and what might not work against COVID-19.
So, Mark, as we're discussing this, it does strike me from everything I've heard, these things take quite a bit of time. I just heard from the vice president yesterday that there's this possibility that we come to October and there's a resurgence of this. We've seen it apparently previously with the 1918 flu. There's these sort of rounds of the virus getting out and infecting people. Do you think that that's likely? And I know I'm putting you on the spot a little bit with that. And if so, what do we do? What needs to happen before October for us to be a little more effective in terms of how we deal with this?
Yeah, well, I mean, most experts agree that that's really inevitable, that there will be, subsequent waves, and, how well we handle those will depend on how well we prepare in the time between this hopefully soon upcoming peak in disease and the next wave. So, it really, all the things that didn't go right this time around, hopefully we can get better next time around. I think there's a few critical things that need to happen. I would, categorize maybe three. Obviously, what's happening now, where everyone is doing their part by social distancing, staying at home as much as possible. Those are all great mitigation strategies for preventing any of these pandemic situations. But what really needs to happen, behind the scenes is that uh, our testing capability. So the tests have been developed. That's not the problem, and they've gone from gone to very rapid turnarounds. Even 15-minute results. However, obviously those tests have to be ramped up. The manufacturing those tests have to be ramped up, and a test is nothing unless there's a way to administer it and a way to evaluate it. So again, it comes around to having enough equipment to do this. So not just the test itself, the test requires reagents that are in short supply currently. So they've been developed, the work has been done, the design has been done, but in order to ramp up and manufacture enough, we need lots of everything. We need from the swabs that are used to obtain the sample, to the protective gear that the people administering the tests have to wear each time, and having more efficient protective gear. Because currently, typical recommendations would be that after every test, someone should have to apply new gear. So things like that are really hampering the ability to do testing. So we need better ways to do that, and we need massive quantities of these supplies to do that as well. And then the third thing really, is not just supplies for testing, but supplies for everyone, especially healthcare workers need lots and lots of protective personal equipment to protect them because they're on the front lines for this. I can remember, back in the late 80s, I was somewhat on the front lines with the AIDS epidemic. And, I was still a medical student, but I was taking care of patients. And, I stuck a needle from an AIDS patient in my finger. At the time, there really wasn't much to do about that. Now, I escaped that. I dodged that bullet. Nothing ever happened. But, I had that same fear that I know a lot of healthcare providers are having today as they take care of these patients, because not only is it dangerous, but in normal circumstances, but it's extremely dangerous when you don't have the right equipment, which is already happening here in the United States. Something I never thought I'd see, but we need a massive buildup of the protective equipment. I would say at the top of that list is the N95 respirator masks, which are really important for people taking care of patients with this disease. But there are many other things that are needed as well. So we need a massive supply of those for our healthcare providers. Estimates are we need somewhere in the neighborhood of 3 to 4 billion of those respirator masks, and our current manufacturing capacity doesn't even come close to that. So we need engineering solutions, and I think our alumni and our students can help in this way. I really think the current masks are fine, but if someone could develop a mask that was even more effective than 95%, and potentially cleanable, rapidly cleanable, innovation is going to help in this response to this threat and the response to future threats. So we really need some innovation, and we also need built-in manufacturing capacity to be in place and to be ready to go, and for there to be substantial stockpiles as well. It's not always the sexiest thing, the fancy vaccine or the fancy drug. When it comes to malaria, malaria still hasn't been, there are drugs for malaria, but there still isn't a vaccine for malaria. But, containment really can come down to effective mosquito nets. So, I think the N95 mask is sort of the mosquito net of this biologic threat. We need to get them out there. We need to manufacture them. We need to make better ones so that we can all be protected, and not just our healthcare providers, but for the sake of our economy, we might need masks. Hopefully, N95 masks, potentially for every American, to protect themselves until we can get this under control, or in subsequent waves.
So I do want to do a quick shout out to our honors college students who had been working on new prototypes for Hackensack Medical, and also to our makerspace folks who are working on providing and using their facilities to provide to hospitals some of the protective equipment that you're talking about. Mark, I'm going to take a quick detour. You mentioned something that really shook me, especially because I was growing up in the 80s and the 90s around the time frame where this was so relevant. You said you got stuck with a needle when you were working with patients who were suffering from HIV and AIDS. I've got to imagine that that was something truly difficult to deal with in the moment. Um, do you have any advice for people right now who are maybe undergoing this incredible anxiety or these concerns where, we talk about face masks and full body covering? I know when I go to the supermarket, if I need to go, I think once so far, people sort of look at each other with this fear. Having experienced something so dramatically greater than that, how do you deal with that? How do you get yourself back down in a way where you can deal with the situation?
Well, I mean, everyone will tell you, first of all, don't panic, but be proactive and do what's necessary to protect yourself and your families. Obviously, the first thing is stay home as much as possible and isolate yourselves until we have a better handle on this. Widespread testing, not just of people who are symptomatic, but of asymptomatic people, would go a long way towards, defining who's, potentially infectious and who isn't. But right now, you really sort of have to assume that anyone could be infectious, even if they look like they're doing fine. So you have to take precautions. It's really the unknown. Folks who get infected, they're typically asymptomatic for 5 or 6 days. It's just a fact. So they may not know that they have it yet. So you have to be careful. You don't have to panic, but keep yourself out of high-risk situations as much as possible. And just be smart. Do what the authorities are telling us to do. And something else that I heard: if you think you're being silly, you're probably being adequately protective of yourself. So this is the new norm. This is not you know December 2019 when we didn't know anything about this. This is the new norm, and for now, temporarily, we're going to have to do some things we've never done before. Just like now, we go through heavy, what we think, security at the airport when we didn't do that in the year 2000. So this is the new norm. Do what's necessary. We've all adapted to, the lines at the airports. We'll adapt to this. It's going to look a little different, but, be careful. This is what's effective. Obviously, I didn't even mention the decontamination, using the Lysol sprays and so forth, and washing your hands thoroughly, frequently, and, wiping down surfaces as much as you can. Be calm and be smart.
So, Mark, you've talked a lot about the different solutions that you think would assist the country in dealing with this problem a little bit better. But thinking back to something like the terrorist attacks on 9/11, how there was a series of actions that had to take place, you have to start somewhere. Um, what are the top two or three areas that you think we need to do today to try and build support later on for addressing this problem in a more comprehensive fashion?
Well, they're already in progress. I mean, number one is what we're doing is with the social distancing. That's key, and that's something everyone can help with. I would say number two is the testing issues have to be resolved. Obviously, the designs are there, the tests have been developed, but now getting them up, ramping them up in adequate numbers, and being able to test adequately and trace cases adequately is a key. But in the meantime, isolating anyone we think might be sick is really the only tool we have. But we really have to, I think, expand testing capability. I think that's a given. And the third is what I mentioned also, ramping up production of protective equipment and getting it to the point where there are no longer shortages, where our medical folks are protected and don't have to worry about running out, and don't have to worry about sharing, and don't have to worry about going into a room with a person who potentially has COVID-19 and worrying about going in without it and coming out with it. And that's key, because they're gonna know that those folks are really working hard and taking risks every day. It's part of the job, but shouldn't have to be part of the job to do this in an environment where you're not properly protected. That's not right, and we have to solve that as soon as possible. I would say, we're doing a good job with most of us are doing a good job with the social distancing. The testing, I know they're working in the background, trying to get that solved, and hopefully those supplies are coming. But right now, in certain places like the New York metro area, the supplies aren't coming fast enough, and we really have to improve on that dramatically yesterday.
Okay, Dr. Bagarazzi, I know you're busy, so I don't want to keep you too long. I want to thank you very much for joining us today. I think your insight here was extremely valuable. And I'd really like to continue this conversation in the near future. Let's see if we actually follow some of those steps and how NJIT might be able to help support that. Thanks very much for joining me today.
You're welcome. Yeah, everyone, please stay safe.
So again, my name is Mike Small, and I'm Executive Director of the Alumni Relations Office. I want to invite you to leave messages for Dr. Bagarazzi in our comments. If you're watching this on YouTube, Facebook, or LinkedIn, leave messages in the comments, and we'll forward those on, and we'll continue the conversation. In the meantime, thanks very much. Stay safe, and best wishes for a safe and healthy spring to you and to your families.